Well, welcome to Module 9. In this last module, we will be covering drugs that influence the neurologic system. This includes drugs that help with anxiety, depression, bipolar disorder, and muscle relaxants. These drugs are among the most frequently prescribed. Can you guess which ones are at the top of the list? According to the National Institute of Mental Health, these drugs come in second only to cardiovascular drugs. Drugs for depression and anxiety are in the top 25% of all prescriptions. Over 17 million adults in the United States had at least one major depressive episode, which is about 7% of all adults in the United States. So you will most likely be caring for a patient who is taking one of these drugs. These drugs can be a little bit difficult to understand, so we have included a video for you to watch. So when you're watching this video, make sure that you are paying special attention to the drugs that are covered in this module. Understanding these drugs and the action of these drugs will help you remember the side effects associated with each of these drugs. Most of these drugs in this module, unfortunately, do contain serious adverse effects, which means that you need to teach your clients about how to recognize these side effects and what to do about them. For example, chlorpromazine, which is a phenothiazine, is an antipsychotic, and it can cause extrapyramidal symptoms, such as tardive dyskinesia. These are unusual movements of the body and the face, and it almost looks like the patient has Parkinson's disease. We have another video in this module introduction that covers tardive dyskinesia, so you can see what that looks like. Antidepressants in this module, such as the selective serotonin reuptake inhibitors, or the SSRIs, like fluoxetine or Prozac, can cause weight gain and difficulty with sexual function. So experiencing these side effects can make a client want to stop taking these medications. There's another example of safety concerns that we need to think about with anti-anxiety drugs like benzodiazepines, such as diazepam. This can lead to sedation, which can interfere with activities of daily living, such as driving. Amitriptyline, which is a tricyclic antidepressant, is associated with anticholinergic effects, which you learned about in Module 8. Dietary considerations and client teaching are essential when a client is taking an antidepressant in the classification of MAOIs, or monoamine oxidase inhibitors. Extreme hypertension can result if the client consumes foods or beverages that contain the substance tyramine, which is found in smoked meats, aged cheese, wine, and beer. So this combination, remember, can be life-threatening, and it requires immediate attention. So even though these drugs have serious consequences, they can also assist individuals to have a better quality of life, for sure. So always the risks and the benefits must be weighed with any drug. Enjoy the module.